Hey everyone! You hear about blood pressure all the time, right? But what does it actually mean, especially when they say it's high? Well, today we're going to break it all down. But first, and this is super important, please know this video is for general information. It is absolutely not a substitute for professional medical advice. Your doctor is your number one resource for any health concerns. And if you think it's an emergency, please call 911 immediately. Okay? Great. Alright, so what is blood pressure? Imagine water flowing through a hose or pipes in your house. Blood pressure is basically the force of your blood pushing against the walls of your arteries, as your heart pumps it all around your body. Your heart beats, blood flows, and that creates pressure. We actually need it to get oxygen and nutrients to all our bits and pieces. Okay, so if that's blood pressure, then what is high blood pressure, or what doctors call hypertension? Well, it's when that force, that pushing, is consistently too high. Think of that hose again, but now the water is blasting through with way too much pressure. Over time, this can put a lot of stress on your arteries and your heart. It's often called the silent killer, and we'll talk about why in just a bit. When you get your blood pressure checked, you get two numbers right. Like say 120/80. So what is a high blood pressure reading and what are high blood pressure numbers? The top number, that's your systolic pressure. It's the pressure in your arteries when your heart actually beats and pushes blood out. The bottom number is your diastolic pressure. That's the pressure when your heart is resting between beats. And that mmHg, it just means millimeters of mercury. It's how pressure is measured. Okay, so what is considered high blood pressure, and what is the high blood pressure range? According to current US guidelines, normal is considered below 120/80. Now, what is elevated blood pressure? That's when your top number is between 120 and 129, and your bottom number is still less than 80. This is like a heads up, a warning sign. Then you get into high blood pressure, or hypertension stage 1, if your top number is 130 to 139, or your bottom number is 80 to 89. Stage 2 is 140 or higher for the top number, or 90 or higher for the bottom. And anything higher than 180/120, that's a hypertensive crisis, and you need emergency care immediately. Sometimes people specifically ask, what is high diastolic blood pressure? That's when your bottom number is consistently high, say 80 or more, or 90 or more, depending on the stage. It means your arteries might not be relaxing properly between heartbeats. And that still puts extra strain on your heart and blood vessels. So yes, both numbers are important to watch. Now remember, I said it's often called the silent killer. So what is high blood pressure symptoms? Well, here's the tricky part. Often there are no symptoms at all. Many people walk around with high blood pressure and feel perfectly fine. That's why regular checkups are so important. When symptoms do happen, and they don't always, they might include things like severe headaches, sometimes nosebleeds, feeling dizzy, or lightheaded, shortness of breath, or even chest pain, or vision changes, and for those last two you should seek help immediately. But please don't wait for symptoms to find out if your blood pressure is high. So what is high blood pressure caused by? Well, it's often a mix of things. Lifestyle plays a huge role, things like a diet high in salt or processed foods, not getting enough exercise, smoking, drinking too much alcohol, and chronic stress. Sometimes other health conditions like kidney disease, thyroid issues, or sleep apnea can cause it. Genetics and family history can also play a part. And as we get older, the risk generally increases. Being overweight is another significant factor. Now, what is high blood pressure by age? While it's true that the risk tends to go up as we get older, it's really important to know that younger people, even kids and teens, can develop high blood pressure too. And a special note about what is high blood pressure in pregnancy. Conditions like preeclampsia or gestational hypertension are serious and require very close monitoring by a doctor, because they can affect both the mom and the baby. Just a quick note if you're wondering about what is high blood pressure reading, UK versus the US peoples. The specific numbers and guidelines for what's considered high, and when treatment starts can sometimes differ slightly between countries. For example, in the UK they might use 140/90 as a common threshold for certain decisions. The most important thing is to be aware of the guidelines where you live, and always discuss your numbers with your doctor. And finally, what is high blood pressure medicine? There are many different types of medications that doctors can prescribe to help manage high blood pressure. They work in different ways, like helping to relax your blood vessels or reducing the amount of fluid in your body. These medicines are an important part of a treatment plan, often alongside lifestyle changes. And it's so important, only take medication prescribed for you, and never share or change your dose without talking to your doctor first. A lot of people search for things like how to lower hypertension immediately, or how to control high BP instantly. Here's the honest truth: for chronic high blood pressure, there aren't really magic instant fixes you can do at home to make it permanently normal. Calming techniques, like the deep breathing we talked about, can sometimes help you feel better, and might show a temporary dip if stress was a factor in that moment. But if you need to decrease high blood pressure immediately, because it's dangerously high, that's a job for medical professionals in an emergency setting. The real goal is consistent long-term management with your doctor. So what's the main takeaway? High blood pressure is definitely serious, but with the right approach it's usually manageable. The most important things are to know your numbers by getting regular checks, understand that your lifestyle choices make a huge difference, and to work closely as a team with your doctor. Really understanding what is high blood pressure is that crucial first step to taking control of your health. And just one last very important reminder. This video is here to help you understand things better. It's for education. It's not here to diagnose you or tell you how to treat any condition. Your doctor is your partner in health. And for any emergency, you know what to do. Call 911. Phew, that was a lot of information, wasn't it? But hopefully it helped clarify what is high blood pressure and all those related questions. If you have any general thoughts, or perhaps topics you'd like to understand better in the future, feel free to share them respectfully in the comments. If this video was helpful, please give it a thumbs up. It really helps the channel. And subscribe for more clear, straightforward health information. Thanks so much for watching, and here's to your health.